Vizag had never had the structures of the scale, and nobody anticipated, be it the public city administration planning or the institutions or the police, fire department, electricity department. So none of the departments were really mentally geared to face a challenge of this scale and this operations. We do a procurement for about 15 to 20 days of our pharmacy. So the supplies will be, the purchase order gets triggered every 15 to 20 days. So luckily for us, as it happened about 12 to 15, by the time the month supplies were all with us, available in our central stores. And since we had already spoken to them, wherever they had a criticality, they tried in doing that within the last one day, and as much, I would say 80 to 70% of the supplies were with us. So there was not a real challenge as was pharmacy, consumables, medicines, all that was available for about 100 odd patients which were there at that time. But the number of patients which were coming and trickling in through the ER was something which were not expected. You know, I mean, our ER is otherwise also very busy and hectic, but during that time there were patients lying on the stretchers, trolleys, wheelchairs, just jostling to get in. And we were somewhere, since the ER support system was good, one by one we were able to support them within the ER and outside the ER. I think the two key nodal points were, one was our main reception area and second was our engineering operations maintenance, the nodal point there. So between two of us, we were trying to ensure that either of us were available in these two places to manage day-to-day operations. We never knew exactly, like, you know, per hour how much the diesel consumption. But I mean, if we shut off the diesel, then there was a call from the ICU. The patients are uncomfortable, please ensure. A couple of large Syntex tanks which we have procured. So out of the three, one we would use for our diesel storage, and the other two we had actually stored about 25,000 litres of water, plus the sump tank which has a capacity of almost about 80,000 litres was filled. And at the same time, our water softener and the RO plant were also on. The ER was on, dialysis was active, ICUs were active, for emergency surgeries, theatre was active. Only the department which was initially for first 3-4 days post hitting were not functioning was the outpatient area. So even all the outpatients were being seen in the ER itself, and we had made makeshift for all the nursing staff on the ground in the first floor. Like, you know, our AC unit, we have a DX unit, 11-ton DX unit and outdoor units. It all got completely toppled off and was dangling with the wires. I mean, it's a huge thing. I mean, if we understand the DX and the outdoor units. So whatever was there on the terrace completely came down. And in fact, we are still working on with the insurance company, just trying to have a compensation for that. Delegated, having confidence in people power, I think that was something which came out very, very strongly. I mean, I never anticipated and expected, like, you know, basic technicians, electricians, plumbers who took on and really took on a mantle and role of operating as a head of engineering and head of biomedical and all that. And I think there we really gained confidence from their taking over the role and trying to manage things which they knew a lot of it, but they just needed a hand-holding and kind of a support, which we were there to see that continuously for almost a week, 10 days, I think both of us stayed within the hospital. I think the support from the government, though morally, yes, they all came, visited us, told us any support, anything which you require, we will be able to help you. But on the ground level, I think they were also not equipped to support anybody, because there were too many things in the city administration itself which they had to. In fact, a couple of times we had to go to the collector's office, DM office. We had a couple of meetings with them. They asked us what kind of expenditure we had incurred, how many patients have we treated. So we were on a continuous dialogue with the city administration, but I think on their own, since there were too many issues to handle outside, they were not physically in a position to support individual institutions. I mean, everybody had to fend on themselves. I think at multiple levels there was leadership emerging. There were people were taking on roles, challenges, and we saw leadership at every levels. I mean, we were there just to kind of be supportive. I think the real leadership came from the ground level staff, be it housekeeping, be it nursing, who, in spite of all the adversity, at no point did anybody complain about anything. Just to put perspective, with the support which we got through the government, the health minister himself was personally here, Dr. Kamlani, went about the ER and few of the key areas of the hospital. He came along with the secretary and the I think the district magistrate was also there, just to check on how we were coping up with certain things and we needed support on certain areas. They assured us completely that every aspect they will ensure, including the diesel supply, because that is where we requested them.